Hi there, welcome to our JOYA Integration webcast. I am thrilled to announce our newest integration with our partner JOYA, which is the first employer-sponsored skin health benefit that employees all across the country are taking advantage of right now. And it's really focused on preventative maintenance for skin cancer checks, sunscreens, aesthetic consultations, facials, pills, the whole gamut. But the hope is that it's going to drive patients into your practice who are eager to be treated by you, to have their skin cancer checks done, and to become a lifelong patient of your practice. And with us today is Mike Jafar, who is the CEO of this company, really the mastermind behind it, with a long history in aesthetics. And his goal, as well as all of JOYA's goal, was to really tackle the skin cancer epidemic, if you will, and to help connect people like you, practitioners who have the knowledge and the know-how, with patients to help prevent the skin cancer dynamic or epidemic, but also to provide really great benefits for them that bring them into your practice so you can have, again, a lifelong patient in aesthetics. And I think it's going to be a great way to drive revenue into your practice with brand new folks who have never been to a med spa ever, brand new in your community, coming to see you and who are eager to get treated. So without further ado, I'm going to introduce Mike, and we're going to walk through the entire JOYA process, what it's all about, how it benefits you as a practitioner, how to get signed up for it. Then I'll go through at the very end how it works inside of Aesthetic Record to make it easy for you and seamless, and hopefully you can see a lot of patients very quickly without having to do a lot of extra work. So Mike, I'm going to let you take it away.
Thank you for having me. Appreciate the time.
Absolutely. And you have a long history in aesthetics. You are probably one of the most decorated aesthetics veterans that I know. You've been here for many, many years. You've kind of seen it all. And so I think this is such a cool thing coming from you because you understand the practices so well and what a great benefit this is both to the community, the employer, employee, and the practice. So I can't wait to hear all about what you're going to show us today and walk us through the JOYA benefit.
Thank you, and appreciate you aging me. So look forward to the discussion. But it's been fun being around this industry over 2 decades now.
Yeah. Well, kick us off. Let's hear all about JOYA.
Yeah, I started the company with the one mission in mind, which is to find a way to lower the cost of acquisition for practices. And frankly, just having been around this industry, it's not just practices. You also have manufacturers that have to spend quite a bit of money to just acquire new patients. And I thought if there could be a better model, then we might all win. So as Tiffany mentioned, the goal here is to create a nice relationship between JOYA and Aesthetic Record and providers that are on the network so that we could seamlessly send patients to your practice with minimal to no cost. My background in this space, stems as far back as Juvederm, Voluma, and those product launches, and working on Kybella and Botox and everything great that came with Allergan, cool sculpting, Skin Medica, you name it. Then I had the opportunity to go launch Evolus and be the chief marketing officer there, and currently sit on a few boards and investing in a couple of companies in the space. So this is one of the core companies that I've been working on for the last 3 years. And excited to share the goal here. The idea of creating a corporate benefit is definitely not an easy one, but it's one that's been replicated in many different healthcare fields. And if you look at skin, it's our largest organ. It impacts our health and our mood. Everybody is impacted by something skin related, whether it's hair or your total body. And yet, from a benefit standpoint, corporate America spends nearly $20 billion a year managing healthcare voluntary benefit, and there isn't one that's focused on skin. You could get your pet insured, you could get your vision insured, you could get your teeth cleaned. There is a benefit for everything: fertility, maternity leave, massages. I mean, you name it. But yet, one of the most important organs, of our bodies is not rolled up as a benefit, and that's ultimately what we did at JOYA. We asked employees of Fortune 500 companies, if your company offered this as a benefit, would you consider it? Would you pay for it? Would you want it? Nearly 80% of people said this is as important as vision and dental. So my hope is that every company that brings on an employee or goes through open enrollment for their healthcare benefit, they get the options of health, dental, vision, and skin, and likely in that priority. The big driver here, and as to why I think corporate America is interested in this, the average employee age is about 41 across the US. And that's kind of at the upper end of a millennial, right? But an HR executive at any company is having to manage 3, 4 different generations today. And if you look at the stats here that McKinsey shared a few years ago, you have Gen Zers and millennials, which is consuming a large portion of your workforce, actually spend more on their appearance than they do their healthcare, their fitness, their nutrition, and so on and so forth. So this category has to be addressed by corporate America in order for them to maintain competitive advantage and obviously employee retention. And that's ultimately what Joya is about. Uh, but we built the company with the providers in mind, because I've seen so many marketing companies, agencies, platforms that just ask you to put money in and hope that you get a patient. And if everybody's doing it, then it becomes expensive, but also becomes very hard to differentiate yourself because it's a couple marketing agencies that go around this industry and they market their services. So everyone starts to look the same, right? The offices look the same, the Instagram ads start to look the same. And so I wanted it to be free and differentiated. So we'll talk a little bit about how Joya can benefit you as a practice. I'll start with your true acquisition cost of acquiring a new patient. Everyone has about 20 to 30% capacity across the US, right? At every practice. Most practices are running in the low teens in terms of margins. And the driver of margins, right, from your revenue to your net or your EBITDA is cost, right? That delta is predominantly sucked up in manpower, right? Staff, products, and then what it costs to market those products and staff. So what do you pay for? You likely pay for services like real self-advertising, maybe Google SEOs, maybe some ads on Meta. You probably hire a PR agency, maybe a marketing team, maybe a social media team, right? On top of those hard costs, what you probably don't dollarize is what you also need in your practice. Perrier and cookies and waterfalls and text systems and CRMs and marketing and automation. And I mean, the list goes on and on and on. And so that is not a scalable model if you have to deploy this every single time and then constantly spend more over time, which is ultimately what I'm interested in eliminating and or decreasing radically for you all as providers. If you look at healthcare in general, right, albeit it's broken in many different places, it kind of works as well. You have 200,000 dentists in America. Some dentists have carpet that is running from the ground floor up to their walls, and they have no interest in modernizing their place and spending money on Instagram. And yet they're booked out 2, 3, 4 months. There's 40,000 optometrists in the same vein. There's there's about 1,500 endocrinologists that focus on fertility. And yet all of these folks and these specialties aren't fighting one another or spending money on SEO. They're simply contracting with a third party that's selling these benefits to these services, right, across corporate America. But when it comes to aesthetics, you're on your own. Figure it out on your own, spend on your own, acquire on your own. And you have to be a great provider. You have to have great outcomes, great tableside manner, great technology, great software, and you have to be a great marketer and an accountant. That's just a lot. It's just a lot on a provider. And Joya's aim here is to contract with as little or as many providers as needed in order for us to move bodies from corporate America into your practices. Some of our customers, and we've been at this for about 2.5 years now, and this year is a critical year to scale because contracts are starting to come in on a regular basis. But we tend to get a lot of traction in the real estate space, in the educational space, hospitality, finance, fashion, legal. Every industry that cares about their employees, their well-being, that potentially happen to have employees outside driving around getting beat up by the sun, truly appreciate a benefit like ours. So what is the benefit? How do the economics work? And how could this be a win-win for all? So here's what we promise corporate America. we went at this 2 years ago and we said, hey, what if you were to cover Botox? What would you think? An HR manager said, thanks, but no thanks. We're not into this for a product. We don't care to promote a product. We could promote a platform or support a platform, but we're not going to support products per se, especially one that's anti-aging. So then I said, okay, what if our practices offer free skin cancer checks? It's not a diagnosis, and it's above board, and legally it's a free check. What would you say to that as a benefit? In corporate America, mainly HR executives said this would be amazing. I can't get anyone to get a skin cancer check, and it's in my top 5 areas of spend. On average, a self-insured employer will spend $40,000 on one case of skin cancer. And if we could catch it early and navigate that patient to dermatologist, then that cost goes from $40 to $2,000. So the ROI from an HR standpoint made sense right at that point. So we tell our members, you get a free skin cancer check and a free sunscreen, a medical grade sunscreen, and that's your first visit. We at Joya will train anyone on how to do a skin cancer check. As a matter of fact, our chief medical officer, who's a Mohs surgeon, trains hairstylists on how to do skin cancer checks regularly because it's something that's very easy to spot. And then on their way out, when they get that medical grade sunscreen, we will also reimburse the practice for the cost of goods on that sunscreen. So that is the first visit that we promise our members to experience. That unlocks what we call our wellness category. And that wellness category is broken up into a couple things. Number one, we load a digital wallet with $500 of credit. This is not money exchanging between us and employees and yourself. There's no money exchange, but it's truly a credit. And we tell every member that that credit is broken up across 4 quarters. So every time you go in for a facial or a Botox, you get a reduction on your bill of $125. You also get 1 facial a year and an aesthetic consultation. The goal here is to get a patient in your office or in your practice, getting their facial, getting a consultation, and start their anti-aging journey. And then lastly, we like to make these members feel special, and we ask that our providers and our locations offer a unique discount to medical grade skincare products. Whatever you normally would do once a year or twice a year, offer them that discount for the course of the year, because we want to promote better skin hygiene, and obviously skincare is critical. We have practices offering 30% off, and most practices offer 20% off for all of our Joya members. And then as they go home and they either fear that they have skin cancer, they need a prescription or whatnot, we have a telederm service that they could simply text a picture and we'll fill their prescriptions and or confirm if that mole is truly not a mole and it should be something that they check out immediately. So that's how the package is broken up. And in terms of cost to you, and I think that's probably the most important part of this whole section, do know that we cover this medical grade sunscreen in terms of the cost of goods, and we cover the facial in terms of cost of goods. So whatever your cost of goods and whatever your choice of product is, whether it's a peel or a facial, whether it's an Ulta medical grade sunscreen or it's a Skin Medica, whatever the case may be, we'll cover the cost of goods. The real cost here is really in that $500. And that $500 is only a cost when that patient is there paying for some service. And that is broken up, as I said, over the course of 4 quarters. So if you think about it, that $500 in retail value usually costs you anywhere between $150 to $200, depending on the procedure. So if someone comes in 4 times a year spending money, you're ultimately acquiring a patient for about $150 to $200. That's really the only cost in the system. What we do from brokering into a company and then getting a patient into your practice is really where all the heavy lifting is. We learn a lot about these patients. We learn what they're interested in, what they're looking to address, and we market them every 2 weeks through their employer. Their employer will send us access to that member. And every 2 weeks, they hear about something that is completely product agnostic. We don't select products, we don't sell products, we don't make money on products or services. We just say that you're concerned about hair loss. Our providers can do XYZ, PRP, prescribe, laser caps, so on and so forth. You were concerned about weight loss. Our providers offer GLP-1s and so on and so forth. So we are the marketing engine on the back end. We also run these programs inside of corporate America. We recently signed a large fashion house, and they're a well-known brand, 3,000 employees, multiple states, and their corporate office is in Southern California. So we brought our dermatologists, our local dermatologists, and our local practices to that office and share with them all the things that you're capable of performing at your practices, so that they see it and hear it directly. And then lastly, our chief medical officer will conduct webinars once a month on some set topic related to their skin. So my hope is that at scale, as we land more of these contracts, you could sit back and say, you know what? I have a nice steady stream of these JOYA patients. I didn't have to spend money for them. The only cost was really when they were here spending money. And I didn't have to market them, educate them, and they came in ready to go. That's kind of the ideal scenario, I think for both parties. To date, we're in about 30 or 40 companies. We're across 10 states, over 250 providers on their network. Most of them are dermatologists, about 50% are dermatologists, the rest are med spas and plastic surgeons. And from a member standpoint, nearly 36% of our members, when asked, and we ask everyone, have you ever been to a med spa? Have you ever gotten a facial? Have you ever engaged with your skincare? And 36% of these members have never had any aesthetic treatments. So if this scales with millions of members, I think we could be a nice source of a steady stream. Here are the top areas of interest that they tell us they're interested in. Facials, peels, top 1 and 2. Neurotoxins is the third one. Weight loss is the fourth. And then everyone could be lasered for any reason. And so that falls in terms of 4 and 5, with microneedling as the last one. There are many success stories. If ever interested, we have 200 practices. Some are getting a disproportionate amount of patients just because we have tons of contracts there. Some are just on the network, just waiting for us to get into that city or zip code. We have a great med spa and a great dermatologist that literally text me or call me and tell me that if it wasn't for you, January would have been such a slow month. We see 2 to 3 patients from JOYA a week that we didn't have to fight for, engage in any other way, or spend on. So thank you for making us a prominent practice in your network. As I said, we're across 10 particular states and about 250 plus providers, and I'll close on this slide. Because we don't make any money from providers at all, I recommend you just simply claim your zip code, because what we promise our members is there'll always be one med spa and one dermatologist and one plastic surgeon in a particular 10-mile radius or 15-mile radius. And until those practices come to us and say, I cannot see any more JOYA patients, we don't really have an incentive to just keep onboarding more practices. So this is truly a first come, first serve basis. If you land in a state that we have plenty of business, you'll start to feel it right away. If you don't, claim your zip code, and then we will start to sell those capacities and or those areas over time, and then we'll fully train you as soon as we land those contracts. Appreciate the time, Tiffany and Aesthetic Record. Really appreciate the partnership. I think what I see outside of Aesthetic Record is a very slow and broken system. Every time a patient checks in, that front office has to jump to another portal. Every time a patient checks out, the front staff has to jump and manage what credits is remaining and what do they qualify. And I couldn't be more excited for this partnership for this exact reason, which is kind of this asynchronous relationship between our 3 companies.
Mike, thank you so much for walking us through that. If I had a practice right now, I'd be claiming my zip code. I would have already claimed it when we started this whole process many months ago, but we've had several AR people who have been eager to get started. They've already signed contracts, are up and going, and the results, I'm sure, have been fabulous because what you mentioned, the cost of acquisition is very high. We're all fighting for the same patients. You're producing brand new patients that haven't ever been in a clinic before, but also coming in very hot. They're a hot lead, if what we call it here is a hot lead. Very motivated to take care of themselves and take care of their skin. So I think it's such a cool concept, even for our own employees here. We talk about these things all the time about what it means to retain employees, to get them happy about their job and satisfied. This is it, and now we get to be part of that as the aesthetic industry. So I am thrilled for this, but I think what you mentioned at the very end is it's clunky, right? If you're doing two systems at once, I'm going into a provider portal, I'm going into my AR portal, it becomes very cumbersome and laborious for practice. So we came together and said, let's make this thing easy. We love the concept. Let's make it very, very simple for our users to work with an aesthetic record and do the whole thing. So I'm going to not go through the whole entire integration because there's a lot of front-end things that you do to set it all up, make it look the way you want it to look, have the right products and things. But I want to walk through just the way the chart works. I think that's kind of the nuts and bolts of all of it is the patient comes in and gets the things that Mike mentioned, the sunscreen, the consultation, skincare check. How does that work in aesthetic record? How do you actually chart that, redeem it, and sort of the whole workflow. So I've got a patient pulled up. We're going to go ahead and get in my iPad here, and we're going to walk through our patient. She's fictitious, Chrissy Jefferson, who is a JOYA employee. She has a benefit with JOYA. So if we'll go ahead and get that pulled up, I will show that real quick. And I've already done all of her procedure stuff for her, so we know she's a JOYA patient. And this is as easy as it's going to be for you. If you have JOYA in your practice and you're seeing patients, quick and efficient, nothing in your workflow is hardly any different. It'll be seamless for you. So I've gone ahead and, unlike Mike said, I did all of it in one practice visit. I did not split it up. I'm not a very compliant patient. All of it in one day. So she's had a facial, as you guys heard, that's redeemed through JOYA. She's had a consultation. She had her skin cancer check, and she's also received her sunscreen. So a lot of things happening today for her. So just like you guys would do now in your practices, you would chart on the face as you see it today. We're going to go ahead then and just do our little pay button here. And what you'll notice is a new option in the wallet for JOYA. So we see here we have everything at full price. We do have some kind of funny prices, like $1 for the skin cancer check, just for the time being. We're in a testing environment. But the main thing is to see you do have a full price facial and a full price sunscreen in the cart. So I'm going to go to her wallet, and she's already connected her JOYA benefit. So we can see here a new box that says JOYA benefit on it. We'll go ahead and click apply. And you get this really nice little pop out that shows you everything Mike just covered in one little box. So you can see all the things that she has available for her because of JOYA. So her full credit, she's not used any of that so far because she just started with us. She has her skin cancer check. So yep, our diagnosis, she had negative findings. All good, her skin looked perfect. We'll go back and do the rest of it now. So we have her discount, which she's not gonna need here. We had her free facial. It went ahead and applied it for me. Yep, because I have let the system know that that facial qualifies for JOYA. So if you guys think about your own practices now, you may have a bunch of different procedures in your inventory, but we can say we want A, B, and C to be the services for JOYA. You can pick all that up front, so it's very, very simple for you in the checkout. It's auto-applied, easy to do, and it's only the things that you want to use for the JOYA benefit. So we'll keep going here. We also have our free consultation, and just really for tracking purposes for you, because you know it's free, but it's nice to know what you've done and how many folks have come in because of JOYA and then converted obviously to a paying aesthetic patient in the near future. So you'll be able to see all of that too with your booking link. So I'm gonna go ahead and apply that as well. It'll also be on their invoice. So a good reminder for the patient, the employee, this benefit really helped you get all these things at no cost. So it's just good for the plan as well. And then lastly here, our free sunscreen. She received a daily UV protector, which is part of our benefit package. So now her grand total is only $310. Much better price for her. So once I check this thing out here, you will see it, nice invoice that says she has all these JOYA benefits, life is good for her, she's got easy things, and at the end of the day, she gets a free skin cancer check, which is most important, right? The skin health part of it that Mike mentioned, it's a very costly thing for employees and employers. I have self-insurance here at AR. I can't imagine the cost of all of that if I could have just sent a patient to a dermatologist or a medical spa to do a skincare check instead. Huge relief for me if it's me as the employer. So a huge benefit for them, but now you're part of all of that. And I think the cool thing about this is because of the integration, you kind of get a priority when you get your zip code because you're an easy integration for the practice piece of it for JOYA. It's all already set up for you. A few quick things, you get signed on, you get integrated, and you can start seeing patients as soon as they get you processed in their system and hopefully get an employer in your area that needs JOYA benefits. But it's very, very simple for you. Again, no cost for you to get started with JOYA, and we can help you get all of it done in AR in about 20 minutes or so, maybe even less. So very fast, very efficient. But I want to show you just real quick here. Let me go ahead and pay this out. we'll go ahead and just do some cash. And once it's done, on the patient's receipt, you can see where they have all their JOYA benefits. So if you go into your JOYA receipt, you'll see at the very bottom here, which I think is nice to see, the JOYA payment. So it integrates back into your business insights. You can see that that entire service was paid for by JOYA. So there's no real cash changing hands there, but your accountant will be so happy that you have it all organized in business insights for all of your payments for the month. So again, we've kind of thought through, we hope, all the things that you need to make this very simple, because what Mike just mentioned, if he has some big employers who come into your area, you're going to have a lot of patients coming in with a lot of needs. So ideally, this is going to be, again, a quick turn on for you, but the generation of new patients, the new revenue opportunity, and then again, doing really good things for your community, I think, is a part of it as well. I think it's just an awesome system, Mike, and I am super thrilled about us getting this launched ASAP.
Thank you. I appreciate the opportunity. Maybe I could close with one thing. It's amazing what a consumer says and feels when they go into a med spa or a plastic surgeon that's not geared and wired to really care for their skin health. Like, that's a medical thing, your derm does it. Just that one visit to say, I got my skin cancer check and I got my facial, just changes the dynamic of that relationship. So thank you for everyone that is helping save lives, but more importantly, obviously, giving people that sense of youth and confidence at the same time.
And to piggyback on that real quick, I think about this too. If you were to save someone from that entire heartache and trouble of, and just the awful nature of going through skin cancer, because they came in for this and you found it early, imagine just, first of all, the loyalty forever, right, to your practice and to you, but what it did for their life, much less anyone else that they come into contact with, to say, you got to go see my guy Mike. He helped me out. This is, look at what happened for me. I think there's just such an incredible noble cost of this, as well as it's a great way to get patients in your practice and who are very motivated to take care of their skin. We all want compliant, good patients. These are the ones that you want in your practice. So we'll put the QR code in this video as well for you guys to see it at the end. Click on that. If you have any questions, you can certainly email us or chat us. We're glad to help you get connected with JOYA. And then once you're ready to go, we'll get everything set up for you so you can start seeing those patients and taking advantage of this awesome new integration. So with that, I'll sign off. And Mike, thank you for your time today. I appreciate it.
That's a pleasure. Congrats again.
Thanks, you as well.
Wonderful platform, and looking forward to working with your providers.
Well, same here. Congratulations to you guys as well. And we'll see all of you next time. Bye, guys.